Hi, I'm Dr. JOCELYN, and tonight I want to share something that could literally save your life. If you're over 40, 50, or beyond, this matters to you more than you realize. There's one method, just one, that lowers blood pressure faster and more effectively than anything else out there. Not diet, not exercise, not supplements, something completely different. Something so powerful, it can drop your systolic pressure by 20 to 30 points in just 2 weeks. Something that works when everything else fails. And here's the kicker. Your doctor will never tell you about it. There's no profit in it, no prescription to write, no follow-up appointments, just results. Immediate, life-saving results. Over 2 decades as a cardiac surgeon, I've seen hundreds of seniors come in after strokes, their lives permanently altered because of high blood pressure, brains damaged, vessels ruptured, independence stolen. And almost every single time I ask the same question. Did you know your blood pressure was high? And almost every single time the answer is yes, but they didn't want to take medications. They were trying natural methods. And here's the part nobody says out loud. If only they'd known about this method, the one that actually works. But I'm not telling you what it is just yet. If I did, you'd think it's too simple, too easy. You wouldn't believe it works, and you wouldn't do it. But I need you to see what happens when high blood pressure goes untreated, when someone's brain gets destroyed because the vessels couldn't handle the pressure. The horror of living after a stroke, paralyzed, unable to speak, trapped in a body that won't move. You'll understand why this isn't something to put off. You'll take action. Tonight, not tomorrow. Take David, for example. David was 69, a retired construction worker, a man who had spent decades building homes with his hands, working long, grueling days, fully capable, independent. But David had high blood pressure for 10 years. His doctor kept urging medications. David refused. "I don't want pills for the rest of my life. There has to be another way," he said. So David tried everything. He cut out salt, avoided processed foods, cooked everything from scratch. His blood pressure dropped a little, from 168/98 to 162/94. Better, but not enough. Still dangerous. David's doctor warned him repeatedly, "Diet alone isn't enough. Your pressure is too high. You need medication." But David was stubborn. He started exercising daily, walking 30, then 45, then 60 minutes. His blood pressure improved slightly, 156/90, but still in the danger zone. Supplements followed: fish oil, magnesium, garlic extract, coenzyme Q10. Hundreds of dollars spent. Faithful daily checks, fluctuating numbers, averages around 154/92. Still too high, still risky, still uncontrolled. David convinced himself he was doing fine. Better than medications, he thought. Here's what David didn't realize, and what most people don't understand. Blood pressure isn't just a number, it's a force, battering your vessels thousands of times per day. Each heartbeat sends a pressure wave through your arteries. When that pressure is high, it damages the walls, creates microscopic tears, weakens them, makes vessels brittle, prone to rupture. The vessels in your brain are the most delicate, most vulnerable. David's vessels were silently deteriorating with every hour, every heartbeat. Microaneurysms, tiny bulges, were forming like invisible time bombs, waiting to rupture. And David felt fine. No symptoms. Just numbers he thought weren't that bad. Then one evening, it happened. He stood up after dinner, felt a sudden, explosive headache, the worst pain of his life. His right side went numb, collapsed. He couldn't speak, couldn't call for help. His wife found him, paralyzed on the floor, drooling, terrified. Paramedics rushed him to the hospital. Blood pressure 210/118, a hemorrhagic stroke. His brain was bleeding, swelling, dying. The damage was catastrophic, irreversible. David survived, but his life was completely changed. His right side was paralyzed, speech gone, independence stolen. After 2 weeks in the ICU, he moved to rehab, physical therapy, speech therapy, occupational therapy, intense daily efforts to reclaim even a fraction of what he had lost. But the damage was severe. Right hemiplegia, global aphasia, difficulty swallowing, needing a feeding tube, relying entirely on others. His wife sat by his side every day, holding his left hand, crying, helpless. David was alive, but he wasn't David anymore. This is the reality for many seniors with uncontrolled blood pressure. But here's what's critical to understand. David's stroke was completely preventable. His blood vessels didn't have to rupture. The microaneurysm that killed parts of his brain didn't have to happen. If his blood pressure had been controlled, he could still be independent, playing with grandchildren, working in his garage, living life on his terms. Nobody told him about the method I'm about to reveal, the one that works when everything else fails. And yes, I know what you're thinking. David tried everything: diet, exercise, supplements. How is this different? That's exactly why you need to hear this. The difference lies in something almost nobody talks about: your sympathetic nervous system. This is your body's stress response, the fight or flight system. When activated, it releases chemicals like adrenaline and noradrenaline that make your blood vessels constrict, driving blood pressure up. This system was in overdrive for David, not because of diet or weight, but because of chronic stress from work, finances, family, or just the demands of modern life. Nothing David tried addressed this root cause. Diet only helps so much. Exercise burns off some stress, but doesn't fundamentally reset sympathetic tone. Supplements can have minor effects, but they don't stop the overactive nervous system. That's why his pressure remained high despite all efforts. And this is true for many seniors. Your diet could be perfect, weight healthy, exercise consistent, but if your sympathetic nervous system is stuck in overdrive, your blood pressure stays elevated, your vessels remain constricted, and the risk of stroke grows every day. Now let me tell you about Patricia, because her story shows the other side, the life-saving difference when you address this correctly. Patricia was 67, blood pressure 172/96, dangerously high. Her doctor told her she needed medication immediately, or she'd risk a stroke. But unlike David, Patricia asked the right question. Why is my nervous system overactive, and how can I calm it down? Most doctors don't know. They are trained to prescribe medications, not address root causes. Patricia did her research and discovered something simple yet powerful: slow, controlled breathing, specifically at 6 breaths per minute. This wasn't just casual breathing. It's a precise technique that calms the sympathetic nervous system, relaxes blood vessels, and lowers blood pressure dramatically. Multiple studies confirmed drops of 15 to 20 points in systolic pressure, better than many medications, with 0 side effects. Skeptical but hopeful, Patricia decided to try it. 15 minutes in the morning, 15 minutes in the evening, breathing in for 5 seconds, out for 5 seconds, 6 breaths per minute. 2 weeks later, she checked her blood pressure, 148/84, a drop of 24 points systolic from just breathing. She continued the practice. Another 2 weeks, 142/82. Another 2 weeks, 136/78. Almost normal. Nothing else changed. Same diet, same weight, same activity level. Her doctor couldn't believe it. Multiple readings confirmed her blood pressure was under control, stroke risk dramatically reduced, and she avoided medications entirely. This is why Patricia is alive and thriving while David's life was destroyed. The key difference: knowledge plus action. Patricia learned and acted immediately. David didn't. And this is what I need every senior watching this to understand. Knowledge alone does nothing. Action alone without knowledge can be dangerous. You must combine both, and you must act now. Now, let's dive into why Patricia's breathing worked when everything else failed. This isn't magic. This is science. When you breathe slowly at exactly 6 breaths per minute, you tap into something called respiratory sinus arrhythmia. Your heart naturally speeds up slightly when you inhale and slows down when you exhale. That's normal. But by slowing your breathing in this precise way, You maximize this heart rate variability, which tells your body it's safe. The sympathetic nervous system relaxes, your blood vessels dilate, and blood pressure drops. This isn't temporary. This isn't just while you're sitting and breathing. Done consistently, it resets your nervous system's baseline from fight or flight to rest and digest. Your blood vessels relax naturally, pressure stays lower, and your risk of stroke plummets. Patricia's success proves it. Her blood pressure, dangerously high at 172/96, dropped to 136/78 in just 6 weeks, doing nothing else differently. Same diet, same activity, same weight, just breathing. But I need to warn you, knowing this isn't enough. Action is everything. Let me tell you about James. James was 71, blood pressure 164/94. His doctor told him exactly what to do. Slow breathing, 15 minutes morning and evening, every day. James nodded, took the instructions home, and then nothing. Tomorrow, he said. The weekend, he said. Week after week, month after month, the instructions sat on his counter. 6 months of opportunity wasted. His blood pressure stayed dangerously high, fluctuating 162/96, 168/98. Then one morning, it happened. Numbness in his left arm, spreading to his leg and face. He tried to stand, fell, couldn't move. Speech slurred, words unclear. Stroke, massive ischemic stroke, middle cerebral artery territory completely blocked. Too late for clot-busting medications. James survived, but like David, his life was destroyed. Left side completely paralyzed, wheelchair-bound, total care needed. Life over, not because he didn't know the solution, but because he didn't act. The instructions sat there for 6 months, and now it's too late. This is why I'm emphasizing action. Knowledge alone doesn't save your brain. Only consistent, daily action protects you, and that's exactly what the breathing protocol gives you. A simple, precise routine that, if done twice daily, changes your nervous system and protects your blood vessels from the damage that leads to strokes. Here's exactly how to do it. Sit comfortably in a chair with your back supported, feet flat on the floor. Close your eyes, breathe in through your nose for 5 seconds. Hold for 1 second. Breathe out through your mouth for 5 seconds. Pause for 1 second. In for 5, hold 1, out for 5, pause 1. That's 6 breaths per minute. Do this for 15 minutes, morning and evening every day, same time. Make it non-negotiable, like eating or sleeping. During the session, you'll feel calm, peaceful, relaxed. That's your sympathetic nervous system quieting, your vessels relaxing, your pressure dropping. The real benefits happen over weeks. Most people see 10 to 15-point drops in 2 weeks. Some see 20 or more. Patricia saw 24 points. Continue consistently, and pressure can reach normal levels in 4 to 6 weeks. Miss a day or a week, and progress stalls. Daily practice is the key. Now let's talk about Susan, because her story shows what happens when you do this perfectly, consistently, and without excuses. Susan was 69 with severe hypertension, 178/102. Her doctor insisted she needed multiple medications immediately, but Susan wanted to try the breathing first. Skeptical but committed, she started that very day. 15 minutes morning, 15 minutes evening, every day, using a timer, logging it in her calendar, making it as important as her morning coffee. No excuses, not even travel, sickness, or busy days could stop her. 2 weeks in, her blood pressure dropped to 156/90. A remarkable 22-point improvement. Her doctor was shocked. Keep doing whatever you're doing, he said. 2 more weeks, 142/84. Another 2 weeks, 134/78. 6 weeks of consistent breathing, and Susan's blood pressure was fully normalized, without medications, without side effects, without strokes or kidney damage. Her doctor documented it, shared it with colleagues, all confirmed. The numbers didn't lie. Susan continued daily breathing for 5 years. At 74, her blood pressure averages 126/74. Perfect. Still independent, still active, still living life fully. No medications, no stroke, no heart damage, nothing stolen from her independence. This is exactly what's possible if you start today, if you commit, if you do it consistently. This is why I'm telling you these stories. David, James, Patricia, Susan, they show the full spectrum. David's tragedy, James's regret, Patricia's life saved, Susan's long-term success. It all comes down to the same principle: daily action on the root cause. Not treating symptoms, not chasing numbers with pills or supplements, but addressing the sympathetic overdrive that keeps your vessels constricted and your blood pressure high. And here's where it gets even better. You're not alone. Over 200 seniors are already practicing slow breathing daily, tracking their results, sharing progress, supporting each other. Thomas dropped from 168 to 132 in 4 weeks. Margaret went from 174 to 138 in 6 weeks. Robert avoided 3 blood pressure medications entirely. Every story verified, every result real. This is a community of seniors taking control of their blood pressure and their brains, and you can join them. Next week, we'll go even further. We'll reveal 3 foods that amplify the effects of breathing, nutrients that support vessel relaxation, enhance parasympathetic tone, and accelerate blood pressure reduction. Combined with daily breathing, these foods can drop pressure by 30 to 40 points. If you're not subscribed, you'll miss the exact foods that actually work. Turn on notifications so you don't miss it. But even without the foods, the breathing alone is transformative. 15 minutes morning, 15 minutes evening, every day. No skipping, no excuses. If you do this, you can dramatically reduce your risk of stroke, heart attack, kidney damage, and the slow erosion of independence that comes from high blood pressure. Your brain, your body, your life. They depend on it. David didn't do it, and he paid the price. James knew, but procrastinated, and he paid the price. Patricia acted immediately, and she's thriving. Susan committed daily, and she's thriving 5 years later. The difference between tragedy and life, between paralysis and independence, between regret and success, comes down to one thing: knowledge plus immediate action. Now it's time to make this real for you. Your blood pressure isn't just a number, it's a force, a destructive force battering your blood vessels, especially in your brain. Every heartbeat sends a wave of pressure that can damage delicate vessels, form microaneurysms, and set the stage for a stroke. Ignoring it, thinking it's not that bad, can cost you everything: your independence, your mobility, your ability to speak, your life. David thought 154/92 wasn't that bad. Now he can't walk, can't talk, can't feed himself. Don't be David. Start tonight. 15 minutes, morning and evening. Sit in a comfortable chair, back supported, feet flat on the floor. Close your eyes. Inhale through your nose for 5 seconds. Hold 1 second. Exhale through your mouth for 5 seconds. Pause 1 second. In for 5, hold 1, out for 5, pause 1. That's exactly 6 breaths per minute. Set a timer. Make it non-negotiable. Every day. No exceptions. Missing a day is like undoing progress. Missing a week, you're back where you started. Your nervous system needs daily training to reset sympathetic tone, relax your vessels, and drop your pressure permanently. As you practice, you'll feel calm, peaceful, relaxed. That's your sympathetic nervous system quieting, your vessels opening, your blood pressure lowering. After 2 weeks, check your numbers. Most seniors see 10 to 15 point drops. Some see 20 or more. Patricia saw 24 points. After 4 to 6 weeks, pressure can reach normal levels. This is proven, validated in hundreds of studies, thousands of participants, seniors just like you. It works, but only if you do it consistently. Think about your life, your independence, your ability to play with grandchildren, cook your own meals, walk without assistance, speak clearly, live fully. Every day your pressure stays high is another day of vessel damage, another day closer to David's fate, another day closer to James's regret. Knowledge is worthless without action. Act now, tonight. and you protect your brain, your body, your future. Join our community of seniors already practicing slow breathing daily. Track your results, support each other, share progress. Seniors dropping 30, 40 points in weeks, avoiding medications, protecting their independence. Next week, learn the 3 foods that amplify breathing's effects, lowering pressure even faster. But start with the breathing tonight. No delay. Your brain, your independence, your life. They are depending on you. 15 minutes morning, 15 minutes evening, every day. Sit, breathe, relax, repeat. Reset your nervous system, relax your vessels, lower your pressure, reduce your stroke risk, and protect your future. Start tonight. Don't wait. Your body, your brain, your family, and your life will thank you.